medical procedure or injury, sometimes it can be a toss-up when it comes to how your body will heal. Baton Rouge plastic surgeon Dr. Anthony Stevens is here to talk about the scars and marks left behind. So no one really likes scars. No one wants a scar, right?
No one wants a scar, but it's the inevitable result of, a surgical incision or a trauma that we've sustained, like a fall. We all are going to form a scar, and that is the end result of healing. And my partner used to say, if we're not forming a scar, we're not healing. So it's a lot that goes into forming a scar. Unfortunately, all surgeons are measured by how their wounds look afterwards. So what goes into this? If we have a traumatic injury, we have a fall versus a surgical incision, those wounds are going to look different than a traumatic injury. And so if we make a clean cut, it's less trauma, and we are likely to heal much better than if we'd had a fall. If we have skin color, let's say that the skin is very dark, we're likely to form more of a scar than if the skin were fair. So we know that there are some things that go into wound healing and scar formation that we can control. But unfortunately, the majority of it is something that we cannot. Genetics. How did our parents scar? From one scar to the next. So all that's important. So even if that happens, we can still form abnormal scars, as in a hypertrophic scar, or we can even form keloids that we see in darker skin. And the difference there is that the skin, as we see here, hypertrophic versus a keloid on the ear, where the wound actually heals by forming a scar outside the bounds of the wound. This is a wound that we see here that was treated with a steroid injection, and it's one of the things that we can do to help wounds by injecting with steroids, but there's no free ride. It can make the scar widen. And so various treatment options have been proposed, and we're still using them. Everything from topical agents, which we can see here. This is a silicone gel sheeting that's been placed over a scar, and we really don't know why this works, but it does. It's either the pressure of the silica or the silicone itself into making this wound better. And
what did you bring with you?
Yeah, we brought some of this, and this is an example of the silicone sheeting that we actually put over the wound, and you actually wear it for the first 2 to 3 months after the wound is healed.
That's a pretty long time.
It's a pretty long time.
It helps.
Yeah, well, and I'll tell you, I think all of these have their place. Even some of the scar recovery gels that we have here, the Medderma, which is one of the more popular ones. And these have either a plant extract in it. The Medderma is really onion extract, all the way to some of the silica gel products that we see here. And they all have their place, Brittany, but none of these are a magic bullet. They're not going to make a scar go away.
It all depends on a number of factors.
It all depends on a number of factors. Lasers can help with the skin color, but you know what your best friend is when it comes to a scar?
What?
It's time.
Of course.
If you give it time and you're patient, it will improve.
All right.
And,
thanks so much, Dr. Anthony Stevens. We appreciate it. We'll be right back.
A drive-by accident.